All right, hello everyone. We're now streaming on Facebook Live. Thank you so much for joining NNEDV today to discuss the findings from our 16th Annual Domestic Violence Counts Report. It's my pleasure to introduce our President and CEO, Deborah J. Vagans, to get us started today.
Thank you, Laura. Welcome everyone to NNEDV's Domestic Violence Counts Report virtual congressional briefing. I'm Deborah Vagans, President and CEO of the National Network to End Domestic Violence, which is dedicated to creating a social, political, and economic environment in which domestic violence no longer exists. Founded over 30 years ago, we represent the state and territorial domestic violence coalitions who in turn represent over 2,000 member programs and the millions of domestic violence survivors they serve and advocate for each year. Today, we're discussing our 16th Annual Domestic Violence Counts Report. This annual report is a snapshot of an unduplicated count taken in a 24-hour period that documents the number of individuals who sought domestic violence services, the types of services requested, unfortunately, the number of service requests that went unmet because of a lack of resources, and the barriers that domestic violence programs face as they strive to provide services to victims. We are so grateful that you joined us to learn the latest data, hear from our esteemed expert panelists, whom I will turn it over to shortly, and to learn what members of Congress and the administration can do and are doing to advance safety and justice for survivors. We welcome all the congressional staff, members of the administration, survivors, press, state coalitions and their members, fellow activists and advocates, all of who are joining us today. And we express our gratitude to the nation's domestic violence programs for all that you do to keep survivors safe every day and for taking the time every year, and especially now, for participating in our survey. I also want to thank our sponsors, Match Group, Meta, the Allstate Foundation, and Element 74 for their generous support of our report. And we also want to thank our honorary congressional co-hosts, Representative Lucy McBath from Georgia, Representative John Katko from New York, who you will hear from momentarily, Senator Bob Casey from Pennsylvania, and Senator Lisa Murkowski from Alaska. Finally, please join me in thanking and appreciating all the amazing NNEDV staff behind the DV Counts report and the briefing today, our DV Counts team, our development and communications team, and our policy team. They have collected and analyzed data from hundreds of participating programs, developed the report, and shared it with policymakers nationwide. We know that domestic violence is insidious, dangerous, and life-threatening. It undermines economic security and leaves lasting physical and emotional damage. Around 12 million people experience domestic violence every year. NNEDV began conducting this survey 16 years ago to provide information about how many survivors of domestic violence use shelters and services without compromising their safety or confidentiality. This year, our survey took place during the second year of the pandemic, and it was critical to capture the evolving needs of programs. We've learned over the past 2 years that dealing with COVID and its impact, the impact it has on survivors, is a marathon and not a sprint. The stories from this report come together as a testament of the resiliency of survivors, advocates, programs, and coalitions. You will learn as you review the report and hear from our expert that the work goes on under extraordinary circumstances, often with resources stretched in new ways by the demands of the pandemic. It was important to us that this report capture both the hard work of survivors and programs, along with the intense impact of the pandemic and all of our nation's intersecting crises, from the pandemic to ongoing racial injustice to the lack of an economic infrastructure, have on them and their needs. The report sheds light on heroic efforts of advocates at local domestic violence programs as they stretched every penny of funding and leveraged creative approaches to provide essential services to meet survivors' needs under these incredibly difficult circumstances. On the day of our count, September 9th, 2021, 1,536 programs responded that they provided shelter and services like advocacy, legal services, and housing to over 70,000 adults and children in just that one day. Programs shared survivor stories, which you will see throughout the report. Here's one briefly from a South Carolina advocate. A survivor called us in a panic, unable to buy food because her abuser had emptied their joint account. Our staff gathered items for her and her children, and she was in tears when we gave them to her. These items symbolize not just food on her table, but a support system she didn't even realize she had. These are the stories I wish I could fill our time with today. But the report also shows that despite these efforts, many survivors and their children are turned away from shelters when they are full or when advocates are unavailable. In the beginning of the pandemic, for example, programs did not always have personal protective equipment, enough space, or enough funding for staff to manage all the new needs. Now, as this becomes the new normal, budgets must include these previously unexpected costs. And existing barriers to safety for survivors, like lack of housing, the intense need for transportation, hotel stays, and childcare, were further exacerbated by the pandemic. Survivors of color experience these barriers even more acutely as ongoing systemic discrimination made accessing the resources they need farther out of reach. So this report also has the grim responsibility of providing a snapshot of those unmet needs on a single day. The one piece of data I want to leave you with is that on that one day, local programs were unable to meet over 9,000 requests for services, primarily requests for shelter, because programs lacked sufficient resources. These are the stories I hate to tell, but are important to hear. An advocate in Rhode Island reported, Victim of Crime Act funding cuts have affected staff retention, and we're not able to introduce additional services for survivors. Staff members are spread thin, and several have already resigned because the stress was too much. A Kansas advocate shared, we helped a survivor file a protection from abuse order. We tried to get her an attorney, but to no avail. The funding was gone. She was unable to go up against her abuser's attorney, and her protection from abuse order was denied. As you read the report, I know you will conclude that this is unacceptable, that anyone face abuse and not have the help when they need it to find safety. For these survivors, we must and we can do better. We must ensure that all survivors get the support they need. Last year, our report outlined some critical federal legislative responses that were needed for survivor safety. I am thrilled to report that in the last Congress, we achieved several notable victories. There is still much more to do, and many federal recommendations remain. My colleague, Monica McLaughlin, our Director of Public Policy, will discuss our federal recommendations in more depth at the end, but I want to celebrate the successes with you, federal policy successes that will make survivors' lives safer. Since our last DV Counts briefing, 2 of our major policy priorities became law. The first is the VOCA fix to sustain the Crime Victim Fund of 2021, or the VOCA Fix Act, which became law in July 2021 after every single senator voted for it. So many of the programs featured in the DV Counts report rely on VOCA funding to remain open. The VOCA fix saves and rebuilds this vital federal funding source whose reserves had been dwindling over time. It will make a world of difference for the more than 6,000 local domestic violence shelters, rape crisis centers, legal services programs, and child abuse treatment programs in every state and territory that were struggling to meet the growing demands for services in the wake of recent years of drastic cuts in VOCA grants. And this past March 2022, the Violence Against Women Reauthorization Act of 2022 was signed into law as part of the omnibus spending bill. VAWA's reauthorization provided survivors, the thousands of local programs that serve them, and communities with much needed resources for housing, legal assistance, alternatives to the criminal system, and prevention programming. The bill also includes critical economic justice and non-discrimination provisions. It restores tribal sovereignty to hold non-Native abusers accountable, and makes important investments in culturally specific service providers to ensure all survivors are supported. These life-saving protections will give survivors greater access to safety, justice, and services on their path to healing after abuse. with 2 critical pieces of legislation codified into law, there is still more that Congress and the Biden-Harris administration can do to help, such as continuing to center the needs of survivors of color in legislation, appropriation, policymaking, and supporting funding and policies that reduce barriers to safety and justice for survivors who face oppression and systemic discrimination. Funding key programs like VAWA, VOCA, the Family Violence Prevention and Services Act, the Domestic Violence, Sexual Assault, Homelessness Assistance Bonus Funds, and funds for immigration services to address the backlog of survivor visa cases via the annual appropriations process. They can also reauthorize FIPSA with key improvements and fund and implement survivor-centered housing programs. And lastly, but not least, pass economic justice policies to ensure a more stable economic infrastructure for survivors, such as direct cash assistance and workplace protections like equal pay legislation, paid sick and safe leave, expanded unemployment insurance, and job protection so you cannot be fired for being a victim of domestic abuse. So, speaking of congressional action, we are delighted to have recorded remarks from one of our honorary co-hosts, Representative John Katko. He has been an outstanding champion in addressing gender-based violence as the co-chair of the Bipartisan Task Force to End Sexual Violence. He has supported VAWA and VOCA and sponsored the Preventing Sexual Harassment in Public Housing Act. He is also a co-sponsor of the FIPSA reauthorization, which helps ensure that communities have the resources they need to serve survivors. Let's hear from him now.
Thank you to the National Network to End Domestic Violence for hosting this event and for inviting me to join you today. While I'm very disappointed I'm not there to speak with you in person, I would like to thank you for all your long-standing commitment to advocating and working on behalf of survivors of domestic violence. As a result of your tireless efforts, we have seen Congress take important steps in recent months to bolster and expand resources for survivors. Discussions like this are important to recognizing the progress we've made, as well as the significant work that still lies ahead. As a co-chair of the Task Force to End Sexual Violence and a steadfast partner of domestic violence organizations in Central New York, I've heard firsthand on many occasions about the challenges facing service providers and survivors right now. Increases in the demands for assistance, constraints on service providers, unmet needs, and uncertainty in the availability of federal support are all trends that this group knows too well. But you also know the tragic and personal toll that accompanies every individual instance of domestic violence. Today's discussion of the 16th Annual Domestic Violence Counts Report provides an important and glum opportunity to look at this issue from both of these perspectives and to determine what lawmakers can do to ensure that no survivor goes unserved. That is our goal. For my part, I was proud to advocate for the recently passed Violence Against Women Act reauthorization and look forward to monitoring its implementation along with all of the organizations here today. Additionally, I was proud to join Representative McBath in introducing the Bipartisan Family Violence Prevention and Services Improvement Act, and I will continue pushing for its advancements to the President's desk. FIPSA, as it's called for short, is one of our nation's fundamental programs for supporting domestic violence shelters, and it is essential that Congress pass a robust reauthorization as quickly as possible. Rest assured, I will continue fighting for your organizations and the brave survivors you assist through the duration of my time in Congress. I'm humbled by the work you do and honored by this opportunity to recognize the life-saving services all of you provide in your communities. May God bless you all. Thank you, and please keep up the good fight. You're making a difference.
Wonderful. We are so grateful for Representative Katko's leadership. So now I would like to welcome and introduce all 3 of our expert panelists. It's really my pleasure. So first you will hear from Alexandra Appleton. Alexandra is an Oregon native raised in North Portland. She has lived experience as a survivor of homelessness, incarceration, domestic and sexual violence, and recovery. Alexandra has lent her expertise to several advisory committees, councils, boards of directors, and collaboratives, lifting survivor voices in those spaces. including the Oregon Justice Resource Center Women in Prison Project, the Salvation Army's West Women and Children's Shelter, the Oregon State Racial Justice Council, and the Multnomah Sex Trafficking Collaborative. A 2017 graduate of Portland State University and currently a shelter equity and inclusion analyst at Multnomah County. She continues to volunteer in multiple advocacy campaigns to raise awareness of underserved communities, domestic and sexual violence, systems of incarceration, addiction, recovery, houselessness, and racism in Oregon. Alexandra is a devoted mother of 3 young children and dedicated to becoming a good ancestor. Antonia Druvan is the founder and director of the ASHA Project, a Milwaukee, Wisconsin nonprofit serving survivors of domestic violence, sexual assault, and human trafficking since 1987. Her culturally specific program is the first of its kind in Wisconsin and one of the first such programs in the United States. Antonia is one of the mothers of the domestic violence movement, and she worked on the first Violence Against Women Act in 1994. She is a nationally recognized leader on providing culturally specific services and was a co-founder of the nation's first national center on addressing domestic violence in the African American community. Antonia's experience in cultural competency with expertise is cultural competency with African Americans and the intersection of trauma, discrimination, and other societal issues. She serves as a program developer and trainer, writes ASHA grants, works directly with victims from the community, and works with women and men in Wisconsin prisons. And Jonathan Iglesias is the policy director at the Virginia Sexual and Domestic Violence Action Alliance, where he applies his passion for public health and healing-centered systems to the work of movement building and legislative advocacy. He's an advocate, a preventionist, a policy and communication strategist, a technical assistance provider, trainer, program developer, and grants administrator with more than 15 years of experience working in the sexual and domestic violence field. Jonathan is a sociologist by training and an outspoken supporter of Southern social justice work. He currently resides in Richmond, Virginia, where he shares a cottage near the James River with a gaggle of lovable animals. So let me turn it over to Alexandra for a few minutes to discuss her experience as a survivor and how services helped her. After Alexandra speaks, Antonia will tell us about the experience of a local culturally specific domestic violence organization like those surveyed in the report. Jonathan will talk about statewide work to address survivors' needs during COVID. And finally, we'll hear from our Director of Public Policy, Monica, about the actions policymakers can take, and then we will open it up for questions. If you have any questions, you can drop them in the chat or if you're on Zoom, or in the comments if you're on Facebook, and we'll collect them. And after the Q&A, I'll bring us back to wrap up, and we will aim to close around 3 p.m. So, Alexandra, over to you.
Thank you, Deb. It's an honor to be here. And hello, I identify as a biracial Black woman, a mother in a multicultural family of multiracial children. I live, work, and advocate in Portland, Oregon. I am a survivor of domestic violence and sexual assault. When I was 13, formidable things happened to me. And after that initial trauma, like many survivors, over the next 20 years, I was more vulnerable to physical, mental, financial, and sexual abuse and violence. I did not access services until 2013. I was again in an unsafe and unstable time in my life. I was fleeing domestic violence and sexual assault. I was homeless. I had 2 children, a legal history with court stipulations, and I was new in my recovery. The 2 options I was most familiar with was returning to the mentally and physically abusive relationship I was currently fleeing from, and returning to sex work. Although I had many reservations, I had nothing to lose. I accessed the local crisis line and got connected to multiple services, including and not limited to shelter. Specifically, my experience at the Salvation Army's Women's Domestic Violence Shelter provided a safer space for me and my children to heal. We had access to 3 meals a day, clothing, shower, laundry, access to internet, computers, printer, our own room, on-site childcare, child and adult support services, family field trips, one-on-one counseling, and peer support. The location was in an affluent neighborhood with schools, grocery stores, transportation, and a hospital nearby. We had our basic needs met, a safe place to lay our heads, and the trauma-informed services that acknowledged the histories of violence in our lives. In a safer situation with attached services, I obtained employment and worked with the shelter advocate to achieve my housing goals. And I had pretty steep barriers to accessing long-term housing, like a legal history, lack of adequate income or other money, and poor rental history. With housing assistance and advocacy, however, I successfully was able to exit the shelter to permanent housing within 6 months. The trauma-informed and culturally responsive care I received continued after my shelter exit. I received ongoing support for 4 years after my shelter exit. I regained full custody of my children, graduated legal probation, established culturally specific mental health and healthcare within the community for myself and children. And at 33, 4 weeks after having another child, I returned to school to complete a 4-year BA in 2.5 years. The wraparound services that I continued to receive during this time included housing assistance, housing, culturally specific and culturally responsive advocacy, additional holiday supports, peer-led trauma recovery groups, professional development opportunities, referrals to other resources, and any emergency financial support allowed me to remain safe, heal, and build a new foundation for my family, as well as interrupt generational cycles of violence for my children. Once I was provided safe spaces and ongoing support, I was able to get educated and to learn to identify the root causes of my experiences and trauma and tools to interrupt harm, practice harm reduction, as well as navigate systems. In 2017, I graduated from Portland State University with a Bachelor's of Arts in Social Science. I got a job right away. By 2019, I had successfully graduated the program and did not need to utilize any rental and/or advocacy support. And my children and I have been able to remain healthy, stable, and safely housed. Engaging with domestic violence and sexual assault services strengthened my safety, my coping skills, as well as granted me the social capital to show up for myself, my children, and my community authentically. Without the ongoing support, I would not be in position today. There are many times I think I would not be alive. I now work in county government, hoping to shape our homeless responses via the equity and inclusion lens. My lived experience as a survivor who faced and experienced homelessness gives me a unique and grounded perspective. It has been rewarding to collaborate with fellow peers and politicians to support stronger and larger system-wide goals, like eliminating racial disparities in domestic violence and sexual assault and homelessness, and housing instability systems alignment for the most vulnerable and high-quality services. Thank you for your time, and I would like to pass it to Antonia.
Thank you, Alexandra. Your courage is just inspiring. I am deeply thankful for this opportunity to speak to you briefly about my work, who we serve, and equally important, the need for culturally specific domestic and intimate partner violence, or IPV, programs that are developed by and led by people of color. I am the founder of ASHA Family Services Incorporated, now called the ASHA Project, or ASHA, that was established in Milwaukee, Wisconsin in 1987. ASHA is one of the first culturally specific African-American domestic and sexual violence intervention programs in the United States. We participated in the 2021 Domestic Violence Counts Report, as we regularly do, and are proud to join our fellow domestic violence service provider in documenting our life-saving and life-changing work. ASHA's existence in the community stood for equity in services and another option for Black victims and survivors seeking help from gender-based violence. Reflective representation was and continues to be very important. The availability of culturally specific program funding from the Violence Against Women Act, VAWA, ensures that we can continue to provide equitable victim services. ASHA afforded Black survivors community-based access to culturally specific victim services they would most likely trust, conducted by personnel reflective of them. ASHA remains in Milwaukee's Central City, and in January 2017, we fortified in a unique way, attaching fiscally to the state coalition in domestic abuse, Wisconsin. Annually, ASHA serves approximately 350 to 400 victims or survivors of gender-based violence, including domestic violence or IPV, intimate partner violence, sexual assault and sex trafficking, and their families who reside in Milwaukee's Central City, as well as those housed within prisons around the state. Annually, our program participants tend to be 77% African American, 20% Caucasian, and 3% other groups of color. Culturally specific programs developed and led by people of color are so very critical to helping victims and families, and vital for saving lives at risk of domestic violence homicides that are preventable. As an African-American woman born in Milwaukee, Wisconsin, one of the most segregated cities in the country, I was not only culturally conscious, but also a survivor who subsequently learned to thrive. I was incredibly hesitant and unwilling to seek help from mainstream domestic abuse providers. I encountered many other Black women survivors who were also similarly unwilling. Black women told me they were hesitant to use mainstream services for a combination of reasons I similarly shared, such as fear, not being understood, re-victimization, mistrust of systems, and racial bias. The issue of domestic violence is complex in any community, and more so within the African American community and other communities of color. This complexity is further compounded by racism, historical trauma and discrimination, and the lack of access to services in the community. Culturally specific service providers of color intrinsically understand the intersection with systemic discrimination, poverty, in housing, unemployment, drug and alcohol dependency, infant mortality, and health, to name a few, and how these can impact survivors' lives, especially survivors of color. They understand how racialized bias in systems make survivors reluctant to seek support. Survivors who come to ASHA report ease having access to a culturally specific program in the community. They reveal an immediate connection, feeling understood and respected by our staff. They immediately experience familiarity with the warm decor and art reflective of the Black community and its history, with personnel who are reflective of them and warmly greet them. They appreciate being treated with care, non-judgmentally, and as valued and respected individuals. They feel heard and report feeling comfort and a sense of belonging. Survivors feel they can trust us and they believe we can and will help. I will share Kim's story, which illustrates our services and successes. Several years ago, we served Kim, who was experiencing escalating violence at the hands of an armed and threatening perpetrator. Though she was in danger, she initially refused the police referral to a mainstream shelter program. Kim is an African-American woman with 2 young children who lived in the same neighborhood as where ASHA was located. Kim had a high school diploma, worked 2 jobs, and lived below the federal poverty level. She had experienced another serious incident at the hands of her long-term boyfriend, Greg. The ASHA advocate noted signs of strangulation, explained the lethal nature of strangulation, and recommended an ER visit. The hospital revealed Kim had in fact been strangled and had a concussion and was admitted for observation. The advocate stayed with Kim and helped her children get settled at a relative's home. When the advocate picked Kim up from the hospital, Greg was texting and threatening Kim. The advocate and Kim developed a safety plan along with a lethality assessment that had a concerning high score. Kim's immediate priority was housing, which is the greatest need expressed by most of the survivors we see. We made arrangements for Kim and her children to stay in a hotel in a safe location as she began searching for temporary and longer-term housing. Kim feared returning to her apartment, so we arranged a police escort to help her gather important papers and clothing for herself and her children. A survivor-friendly landlord provided an apartment for Kim to rent. The advocate helped secure furniture and other household items and helped change the children's school. While being supported by Asha, Kim found a path to healing by, for example, learning gardening in our green space, journaling, and listening to music. Significant activity took place over several months. Today, Kim remains in recovery and is a homeowner and training to get her license in clinical services, counseling, and substance abuse, and recently completed a master's degree in human services and has applied to a PhD program. Kim is thriving. The survivors we serve often face multiple challenges, including housing instability. We are really excited this year and feel so blessed to be launching a federally funded housing program that has 12 furnished apartments with wraparound services. The project is supported by the Domestic Violence and Sexual Assault Bonus Funds as part of the HUD Continuum of Care program. At ASHA, we rely on federal funds from VOCA, OVC, FIPSA, and HUD, as well as state, city, and foundation funding to provide our services. For survivors of color, not having access to culturally specific programs developed by and for people of color keeps survivors locked into their community and at risk of greater harm and death due to domestic violence, and this is preventable. The day we completed the DV Count survey, our community was experiencing and is still experiencing the impacts of the COVID-19 pandemic. ASHA has been around for 35 years, and these last few years have been some of the hardest, especially as COVID disproportionately impacts the Black community. Having access to culturally specific services developed by and for people of color in their community can be life-saving for many survivors, their children, and the community. Thank you for your time. I will pass now to Jonathan Iglesias.
Thank you, Antonia. I'm honored to be here with these brilliant panelists and want to thank our thought leaders at NNEDV for creating this space to connect and share. My name is Jonathan Iglesias. I'm the Policy Director at the Virginia Sexual and Domestic Violence Action Alliance, and we are Virginia's leading voice on sexual and domestic violence. The Action Alliance consists of a broad network of survivors, advocates, and allies, including more than 65 local agencies who are working day in and day out to strengthen how our communities respond to and prevent violence here in Virginia. So I've been asked to share a little bit about Virginia's housing and legal services work. And I'm excited to do that, but as has become custom in spaces like these, we can't do that without also addressing the deep and lasting impacts that the pandemic has had, not just on survivors in our state, but also on the advocates who work with them. When COVID hit, stay-at-home orders and closures designed to protect the public left many survivors isolated or trapped at home with their abusers. Ongoing job loss resulted in more survivors becoming financially entangled with their abusers, while safe and affordable housing remained in short supply. And the complexity of traumas only grew, resulting in significant upticks in the number of hours our advocates were spending with a single survivor to address their many ongoing needs. In addition to more time spent with survivors, there were just so many more requests. One agency in Virginia reported an 150% increase in the number of people residing in their shelter as compared to the previous year. And keep in mind that these agencies, this one in particular, didn't experience an expansion of their building or planned modifications to their space. These advocates and agencies were just doing what they had to do to save lives, to build safety, and to restore hope for survivors and their families. Advocates risked their own health throughout the pandemic to offer 24/7 services, quickly pivoting shelter and housing to comply with CDC guidance, moving counseling into the virtual sphere while still preserving confidentiality, transporting survivors to emergency healthcare facilities, assisting in filing protective orders and immigration visas, and just so much more. According to 2021 data, on a single day in Virginia, over 1,700 people receive services from our agencies. What's more is that hundreds of survivors told us that working with their advocate prevented them from living in cars or on the streets. Many even reported that the existence of these services literally saved their lives by helping them to escape increasingly lethal violence. They believed, and they told us, that they would have been killed had these services not existed in the community. Our advocates aren't always in the spotlight, but they are always on the front lines. While we seek to move past the pandemic now, its effects continue to ripple throughout our communities. Rescue and Recovery Act dollars have been an absolutely vital lifeline, but our agencies continue to face challenges and struggle to maintain staffing as they meet increased and complex service requests, and as pandemic-era relief programs begin to end. In short, we continue to require flexibility and innovative problem solving at the federal, state, and local levels to address the lingering effects of the pandemic on survivors and to support advocates in accessing living wages and family benefits during these challenging economic times. So this is the backdrop. This is where we find ourselves. Now let me pivot and speak a bit about our legal services and housing work that we're really fortunate to have here in Virginia, and that was born out of HUD and DOJ funded programs. At the Action Alliance, our legal services work is housed under a program called the Project for the Empowerment of Survivors, or PES for short. The goal of PES is to bridge the justice gap faced by survivors. And we do this by providing free, confidential legal consultations with our on-staff legal advocates and attorneys, who then provide access to information and support on issues like housing, protective orders, employment accommodations, name changes, immigration, access to public benefits, child custody and separation. So many of the issues faced by those escaping violence and abuse. In addition to direct legal support, the PES maintains a robust referral network statewide of low and pro bono attorneys who have been trained on trauma-informed lawyering and can represent those survivors who would otherwise fall through the cracks and be forced to represent themselves. These are survivors who either don't qualify for legal aid or are unable to finance their own representation. To this end, we've created and are growing a small but mighty legal fund to support survivors who find themselves needing help. Like this one. A survivor called us seeking assistance with an upcoming custody proceeding. Her husband was incredibly abusive, and his abuse included highly lethal behaviors like the ones Antonia mentioned, like strangling her. She escaped with her 2 children by saying that she was visiting a sick relative in the hospital and then simply not returning. The husband then filed for emergency custody. And this is one of those situations that we see far too often, where the survivor was not allowed to work, so she had no financial resources whatsoever. Her abuser did. Her mother maxed out credit cards to get an attorney for her, but she was still only able to pay half of the retainer, which wasn't even enough to start work on the case. We were able to use the legal fund to pay for the remainder of the retainer fee, and she had much needed representation during the custody hearing, changing both the experience that she had within the legal system and the outcomes. To put this in context, last year, we provided over 2,500 consultations to survivors just like her. We successfully negotiated discounts of up to 90% on legal services and negotiated over $100,000 in free and absolutely life-changing legal services to survivors. So we found that bridging the justice gap is much needed work here in Virginia. And it's just one crucial piece of the puzzle for those fleeing abuse. Housing is another. Over the past year, we've received HUD-DV bonus funding to support the work of a handful of rural agencies across Virginia. We've done a deep dive into the ecosystems of housing supports available to survivors. It's a massive understatement to say that this experience has been eye-opening and humbling. We know that housing is a basic human need, but we also know that there's nothing basic about this issue. This program has helped us uncover spaces where survivor representation was needed to make equitable decisions about housing. It's helped us understand how flexibility and creativity with funding is critical to meeting the diverse needs of survivors who are housing insecure. Virginia, like many other states in the country, is navigating historically low shortages in rental stock, which has led to longer stays for survivors and their families in our emergency shelters and our hotels. HUD-DV bonus funding, as well as emergency housing vouchers, have offered unique pathways to permanent housing for survivors escaping abuse. We've been able to use these funds along with VOCA, VAWA, and FIPSA to expand housing and case management services. It's given us the opportunity to work more strategically with state partners as we improve assessment tools and implement trauma-informed approaches throughout coordinated entry. This work has also motivated local partners to cross-train and case conference with victim service providers, and they've shared the positive impacts that this is creating in their communities. We'll continue to use and expand our limited funding and resources here in Virginia, not just to provide emergency shelter, but to increase long-term, culturally appropriate and accessible housing supports for all survivors. So as I wrap this up, the overarching take-home message from us in Virginia is that advocates and communities here have been caring for each other fiercely and effectively, and they still are as we continue to navigate evolving conditions. And just like survivors, our communities are going to need time to heal after this collective trauma. So it will continue to take all of us, local, state, and federal allies, to move in alignment as we build futures where survivors don't just have what they need to survive, but they have what they need in order to fully thrive. Thank you for this opportunity and for your time today, and I am passing it back to Monica now.
Thank you so much, Jonathan, and all of our panelists. We deeply appreciate your time with us today. I'm Monica. I'm the Policy Director at NNEDV. I'm very grateful to be here today. My heart is swelling after hearing from all of our panelists. Just absolutely bring to life the DV Counts reports with their perspectives. So thank you each so much. Specifically, as we heard from Alexandra, access to comprehensive, trauma-informed, and long-term support helped her and her children access immediate safety, but also set them up for long-term stability. As we heard from Antonia, the vital access to culturally specific services and the life-saving impact it has for survivors of color. And finally, Jonathan, for helping us see the ways that state coalitions work with those frontline advocates to really provide more accessibility for survivors. We're grateful, as Deb said, that Congress this year passed the Violence Against Women Act and the Victims of Crime Act fix. But we are also, we know from the report and our panelists today that there's so much left to be done. So we do have continued congressional asks. And as Deb outlined, we are asking for housing and economic justice policies broadly. And today I'm going to focus on two policies that we're asking for Congress, which is the reauthorization of the Family Violence Prevention and Services Act and federal appropriations. As we heard from Representative Katko, Congress must reauthorize the Family Violence Prevention and Services Act. FIPSA was the first federal funding for domestic violence programs, and it really remains the only dedicated funding for domestic violence programs. It expired in 2015 and must be reauthorized.
We're very grateful that all of our honorary congressional co-hosts are the authors and champions of FIPSA's reauthorization. So that includes Senators Casey and Murkowski and Representatives Katko and McBath. Their bills include key enhancements to increase the funding authorization level, expand support and access to culturally specific programs, strengthen the capacity of Indian tribes, and meaningfully invest in prevention. Now, the House passed their version of FIPSA last year, which is HR 2119, and the Senate Help Committee passed their bill, S 1275. But now it's time for Congress to pass this bill and send it to the president for his signature. FIPSA is absolutely life-saving. We must reauthorize it and expand it and invest in prevention. Speaking of investments, sorry, the annual appropriations process. It's well underway in the House and Senate. And our appropriations priorities align with the Domestic Violence Counts report. All of the things that we hear about that local service providers need to meet the needs of survivors are included in our appropriations asks. And one of the things that you can do as a participant today is have a look at the information in the chat, and it'll have the outline of all of our appropriations priorities. Same with the FIPSA reauthorization fact sheets there as well. So what do programs need? I think we've heard it really clearly from our panelists today. Domestic violence programs need core funding to operate, to pay for their staff and their buildings. They also need money to invest in culturally specific services, access to the continuum of housing, so that includes shelter, transitional housing, and rapid rehousing, as well as long-term housing. We need investments in legal services, as we heard from Jonathan, and we need direct cash assistance. Additionally, we need prevention resources and comprehensive and sort of interconnected resources to meet the needs of all survivors, specifically those who face historical marginalization. This year, we're also highlighting the needs of immigrant survivors who are facing danger as their immigration status is unresolved due to processing backlogs. Our appropriations priorities reach into every state and territory, almost every community, and these priorities often provide a set aside for tribes. So we're reaching almost every survivor that needs support. Addressing domestic violence and sexual assault calls for a government-wide approach and interconnected programs that work together to provide a comprehensive response. We therefore have funding requests across the federal government. So the US Department of Justice, the US Department of Health and Human Services, the US Department of Housing and Urban Development, and the United States Citizenship and Immigration Services. And as you know, the House of Representatives is moving through their process now. There were 4 Dear Colleague letters supporting our funding requests, so thank you everyone who signed onto those. There's still 1 Dear Colleague letter floating around in the Senate. We're very excited that Senator Casey, one of our co-hosts, and Senator Cornyn are circulating a letter asking for FIPSA funding and other related funding. So I would draw your attention now to the fact sheet that's been shared in the chat for our appropriations requests that again kind of build towards that core funding, funding for housing, funding for legal assistance, culturally specific programs, prevention, all of those pieces that local programs need to meet the needs of survivors. So we're asking for $500 million in the Family Violence Prevention and Services Act. And we're asking for direct cash assistance and a new project called the Safe Recovery Together project. We're also asking for $35 million for culturally specific programs in the HHS budget. We're asking for $2.65 billion in the Victims of Crime Act, as you heard from our panelists today, a vital funding source for core direct services. And finally, we're asking for $1.13 billion in the Violence Against Women Act. And our priorities within that program are the culturally specific program, sexual assault services program, transitional housing program, legal assistance for victims, and all the rest of VAWA programs that work together to provide support for survivors. And sorry, 2 more priorities. we're looking for $75 million for the domestic violence and sexual assault bonus funds that you heard a lot about through Antonia and Jonathan, which provide rapid rehousing supports for survivors who are fleeing domestic or sexual violence. And finally, we're asking for funds at the U.S. Citizenship and Immigration Services to help reduce the backlog for survivors who are eligible for visas but are simply waiting for those visas to process. So there's lots to be done to invest in these programs, and congressional staff can continue to help us by advocating with their member of Congress and creating amendments through the appropriations process, signing on to letters, just generally supporting the programs that are so important to survivors. We really appreciate your time with us today, and I'm going to pass it back to Deb.
Thank you, Monica. Excellent. So in the chat, we've put the DV counts report that has our policy recommendations at the back, if you want to check those out, and some standalone fact sheets that talk in more detail. So that was a lot of information, but we have it all at the ready if you want to check that out at your leisure. We have a little bit of time for Q&A, so I'm going to ask Ashley to bring back our panelists. And while she's doing that, I just really want to thank Alexandra and Antonia and Jonathan and Monica for all of your remarks. I am just in awe of all that you are and all that you do, and really and particularly for Alexandra, I really want to thank you for your bravery, for sharing your lived experiences with us. So let me go ahead and I've got a question, and I'm gonna, my first question is for Antonia. So let me pull that up. And so Antonia, you talked about your life-saving work that you have been doing in Milwaukee. We also know, I wish we could only tell those stories, but we also know that local programs struggle with capacity issues, and our report that we're talking about today reveals that on one day, 9,000 requests nationwide went unmet, requests for services. Can you tell us how an organization like yours navigates times when you can't meet a survivor's needs?
As a local service provider, it just really breaks my heart when we cannot meet a survivor's needs, because we know the courage it takes for survivors to reach out for help. So we work with survivors to safety plan, to connect with other resources, and to strategize about where they can go to find safety and support. We are closely connected with other DV programs and other service providers in the community to help make referrals and help survivors in immediate need. We also utilize flexible funding sources to provide survivors with hotel stays, for example. On DV Counts Day, we document survivors' unmet needs while we do everything in our power to help survivors stay safe.
Thank you. It's really, it is simultaneously heartbreaking, but just as we all discussed, it's just a testament to your commitment and your resiliency and the resiliency of the survivor. So just thank you for everything that you have done and you are doing. We have a couple more minutes. Let me ask Alexandra a question. Well, first of all, again, I thanked you as you were coming onto camera, but I just am so grateful that you talked about your lived experience today with us and our audience, and I stand in awe of your bravery. You spoke about having access, how having access to housing was so critical to your safety, and how you built this incredible foundation for your future. Can you talk a little bit more about the elements of that domestic violence specific housing that was helpful to you as a young parent and survivor?
Yeah, sure. Thank you. It's an important question. I think time is one of the most crucial elements. Time not only in the shelter, but time being provided housing assistance, not feeling rushed, not feeling like I had a deadline over my head. And this way I was able to define my trajectory and my outcome on my own terms and in my own time. And that flexibility honestly enabled me to be empowered to really think like, what do I want to accomplish in this time, and how can I actually repair from the trauma that I experienced. I would also speak to trauma-informed care and culturally specific and responsive services, receiving services from people that look like me, that understand and validate my trauma and my experience, folks that understand intersecting identities and the fact that I will feel safer in different spaces, and that can evolve over time. And then in a response, then that will require different services. And I can go on, but the last thing that I wanted to say is it's just the ongoing support. Not only did the support that I got from the shelter system, but the ongoing support across the system. Folks were leveraging services. Folks were meeting me where I was at. They were allowing me to be involved with the programming and direction of where those programs would go. I was able to like show up not only for my children, but myself and my community. So really allowing me to be back to get involved with shaping what the community success would look like. I think that that was also some things that just helped me out. And I've seen it happen with my peers, so I'm not the only one.
Oh, it's heartwarming to know that you are not the only one, because we hear of stories of people falling through the cracks because of lack of support and services and lack of funding. And so again, thank you for sharing that incredible story, and then the amazing life of service that you have. I think we have time for one more question. This may be a two-parter if we have time. Jonathan, I want to get to you. You talked about the life-saving work that your coalition is doing right across from me here in Washington, D.C. All the work that you're doing in Virginia, such as providing legal assistance and housing services. I think people want to know, for those, in addition to serving people who are experiencing domestic violence, what do you tell people about what can be done to prevent violence before it begins?
Yeah, this is a great question. And actually, my beginnings in this field as a wee baby advocate were in prevention. So it's a question that's near and dear to my heart. Prevention work in its most basic form is a merger between public health and movement-based anti-violence work that seeks to empower communities to uncover the root causes of violence and to use experiential, contextual, and research-based evidence to design programs and strategies that build protective factors, build barriers against violence, create new norms, build new structures and systems in which we can learn to support new behaviors. So those are a lot of words, but for us in Virginia, a lot of what this has looked like realistically are programs that teach young people how to have healthy relationships, build social emotional capacity and empathy and communication skills, to become leaders in creating community conditions where safety and equality exist, working directly with parents and caregivers to strengthen their positive parenting practices, to cultivate adult youth mentorship, just all sorts of things. I can go on and on and on. And the last thing I would just say is that we have recently seen an incredible expansion and growth in the prevention work that we're able to fund here in Virginia, since FIPSA has opened up some of the terms of funding and included prevention in what they're funding. So we have seen going from just about 6 agencies that were federally funded to do prevention work in Virginia to almost a third of our membership, over 20, that are now doing robust prevention work in their communities and are just eager to grow that and to continue doing that directly with survivors and directly with their community stakeholders. So yeah, that's it in a nutshell, and I will stop talking.
No, that's great. I mean, the prevention work is so important and go hand in hand with everything that we're doing. So thank you for sharing that. And I know we're over time, but we're going to take just a couple more minutes because your answer really was a perfect setup for Monica to touch on FIPSA, right? The importance of FIPSA and that sort of funding that goes towards that work. So I'm going to turn over to Monica, and then I will wrap up.
I'll be very brief. Thank you so much, Jonathan. I think, highlighting prevention, when we were looking at reauthorizing the Family Violence Prevention and Services Act, one of the things that strikes us about domestic violence prevention in this country is if you've got the resources, you do it. And if you don't, you don't. And so So many communities like Virginia have learned how to do prevention in these amazing ways. But there are so many states and communities that are left out of the prevention mix simply because of a lack of resources. It is something that all advocates are interested in and care deeply about, but the resources haven't been there. And so in the PHPSA reauthorization, we're so grateful for our senators and representatives that wrote the bill and have expanded one of the prevention programs, which is called Delta. And that would go to every state and territory to build on the work of these initial coalitions who've done prevention work in their states, and to really expand that learning across the country so that we can say to ourselves, if you're a survivor in Virginia, or if you're one in Delaware or California, your community is getting better at preventing violence, right? It's not just based on zip code. It's going to be a more broad way to access prevention funds, and we're really excited about it. So PHPSA reauthorization is one way to get that moving, and the other thing is to fund both PHPSA and Delta in the appropriations process. So thank you.
Great. Well, I hate to cut anyone short on this because this is incredible, incredible work, incredible stories, but I know we're over time, so I will wrap us up. I just want to thank all of you in the audience for joining us. I want to thank our incredible speakers here today. Thank you all, our supporting members of Congress. And again, I want to thank our sponsors, Match Group, Meta, the Allstate Foundation, and Element 74 for their support. We hope that each of you will take this information and these stories and urge change with your policymakers, or if you are a policymaker, to move some of these pieces of legislation forward so that no survivor is ever turned away again. This is solvable, and your voice matters. So thank you all for joining us today.